Welcome back to Community Roundup. The American Association of Physicians of Indian Origin, or AAPI, has been stepping up efforts to support India in the wake of the devastating second wave of the COVID-19. The organization has already raised over $2 million from its members, and in partnership with Seva International, they're sending oxygen supply equipment to India. The organization is also launching free teleconsultation for COVID patients in India.
The leadership of the largest ethnic organization representing medical professionals in the U.S., the American Association of Physicians of Indian Origin, or AAPI, has reached out to over 80,000 members who are practicing doctors of Indian origin to raise funds for India. The country continues to add over 350,000 COVID cases daily. Meanwhile, the shortage of medical oxygen in India has shown no signs of abating and people are struggling for treatment. AAPI has partnered with Seva International to fund 1,000 oxygen concentrators.
We recently acquired some oxygen concentrations and we send it through UPS. We are using Seva International for distribution as our partner. We are also acquiring more and more. However, this is not enough. This is the time the largest democratic countries like US and India have to help each other. The United States, I humbly request President Biden and Kamala Harris, please support India in a critical crisis. They need raw material for vaccinations and also for medications and PPE, especially oxygen concentrations, BiPAP, CPAP, and ventilators.
AAPI members also spoke to Indian Health Minister Dr. Harshvardhan via teleconference to understand the requirements of Indian government and work out ways in which the Indian American medical professionals can offer support to healthcare services. The organization is also launching free teleconsultation for COVID patients in India.
We can save so many lives if we can get the basic care and basic education to the masses. So actually we are reaching out to many Indian physicians through our Zoom meetings every night, and we are talking to the doctors and patients directly and advising them how to protect themselves, how to seek help, how to monitor their symptoms, when to seek help, where to seek help. So we're doing all that already, but we want to do it at a bigger scale, at a national level, because thousands of American Indian doctors are ready to jump into the fray. But they just want some clearance that they can do it without any hindrance. So if we can get that assurance from the government, we'll really make a big impact. The doctors are really fatigued back there, and we're going to support them.
Telehealth consultations, we want to talk to the patients to see who is sick, what the saturation is, what the heart rate is, and how the symptoms are, so that we can judge them with our advice, so that we can avoid a lot of unnecessary visits to the ERs and then clogging up the ERs. So that is the main goal of this telehealth platform. So we are starting from 8 o'clock our local time, Eastern time, until 11 o'clock at night every day. So that's India, like 6 o'clock to 9 o'clock in the morning, so that we have a population of physicians volunteering help the Indian population.
Containing the virus is utmost important at this point. And also the vaccinations, as much as they can do, and the Sputnik vaccine, they got a few doses, but if we can send some, I urge US government, the White House, the congressmen, senators, and everybody, and if you have a representative who you know, please call their office and to ask them to put some pressure on White House to actually send these vaccines and help India in a big way. It's a country of 1.3 billion people. We need a lot of help from here, from Indian government, from everywhere, from all over the world. We need help to save lives.
The president of Georgia Association of Physicians of Indian Origin, or GAPI, thanked all the AAPI members for their support.
And like they've all been saying, what we're doing is a very small part, but I think it's a very important part. And it shows the humanity in us. We have to show our feelings, our sympathy, and that we care for our home back in India. I'm from Bangalore. We're all from different parts of India. Everyone is suffering, so any little thing we can do is going to go a long way. At GAPI, we are trying to generate funds to give to AAPI because they're doing such a good job. And I just want to congratulate all of you for everything you're doing.
AAPI has identified 3 telehealth platforms that would offer free service to physicians from India, US, and patients. eGlobalDoctors.com, MDTalk.com, Click2Clinic.com apps are available on iOS and Android.
Gujarati seniors of Chicago